everybody, Luke Gordon here, and a lot of clients that I see after total knee replacement will have a hard time getting full knee extension, usually like that last 5 degrees. And when I say knee extension, I'm talking about your knee just fully straightening. So if you're in that position where, let's say you're like 4 to 8 to 10 weeks out of surgery, and you're still just having a hard time getting your knee to fully extend and fully straighten when you walk and stand, I've got an easy, simple tip that will really help you kind of just push that last 2 or 3 degrees. So that's what I'm going to cover in this video. Leading up to this topic then is that, again, knee extension, fully straightening your knee can be hard to get after total knee replacement surgery. So it can be painful along the back of your knee, and hopefully, again, if you're at least 4 to 6 weeks out, you're at the point now where you're kind of like stretching your knee aggressively. So you're able to do like a hamstring stretch where your leg is out straight and you can push down with some force on that knee, and you can tolerate a pretty aggressive stretch. So there's lots of things you can do to straighten your knee, and hopefully you're doing all those things. But this tip should help because it's an easy one to do and it doesn't take a whole lot of effort. So the tip simply is that when you're walking is to try to start walking faster. Hopefully by now, and it doesn't really matter, again, if you're walking with a cane or a walker. Again, if you're 4 to 6 weeks out, you're probably not using those. But even if you are, or you're just walking like with a stick or a cane, just for support and a little bit of balance, that's totally fine. The tip really is just to walk faster, because what happens when you walk faster is that you tend to take longer strides. You take longer steps. And in order for you to achieve a longer step, what's going to happen is that your body is going to attempt to fully straighten your knee out. And the reason I like this tip a lot is because sometimes when you're walking or you're focusing on one thing with your knee, it's really easy just to kind of mess things up. So it's a good tip, you know, even just when you're walking in general, is don't think about it too much. And if you find yourself kind of like overanalyzing your walking pattern, or, you know, we call it like your gait pattern, don't do it. Try to just walk faster a little bit. And again, what happens with your body then is you've been walking for probably 50, 60, maybe 70 years. You know how to walk. And if you just speed it up, it'll iron out some of those kinks in your gait pattern. And again, when you're trying to get that last 4 or 5 degrees of extension, which can be a lot of like pushing and pulling and, you know, grunting and groaning and all those things, taking a fast walk can really just help speed that process up. And it doesn't typically hurt. It's not uncomfortable or anything like that. So again, that's an easy tip. Just think of like walking fast. You might go like to an indoor setting like your mall, where you've got a nice smooth surface, you know, no cords or rugs or, you know, carpets in your way, where you can just walk fast. Maybe you can walk next to the handrail if you're still a little bit unsteady or not as confident on your feet yet, and just speed up that gait pattern. And don't even focus on extending your knee. Just think of walk faster. And as you walk faster, again, you have longer step lengths, and that's going to help just fully straighten out your knee. So that's my simple tip. Of course, there's other ways to straighten your knee, which I kind of alluded to. I've got other videos on that too. So I hope that helps you. And if it does, or if you have any comments, please leave that below. Any questions in general, of course, leave it below the video. And I would always appreciate a thumbs up and a subscribe before you go. That's it for today. Thanks for watching.